Welcome back here. National Minority Mental Health Awareness Month is happening right now in this month of July. Every July, it's important to bring awareness to the unique struggles that minority communities face. The pandemic has made it harder for minorities to get access to mental health support. So we want to talk about this. This is something that can impact so many people. And we have a gastroenterologist joining us, Dr. Patel. Thank you for being here.
Thank you so much for having me.
I know, to think mental health and gastroenterology, how that combines. First, let's start with that. Explain how that's related.
Yeah, so gut health is very intimately tied to mental health. If you think about it, the gut is actually called the second brain, funny enough. It's because the nerves in the gut actually communicate with the nerves in the brain. Okay, via the vagus nerve, and it works by having the gut bacteria actually make the neurotransmitters. These is what is when you think of serotonin, dopamine, those mood hormones, they're actually predominantly made in the gut.
Wow.
And so because they travel from the gut to the brain. And so if you really think about it, mood is made in the gut. And so depletion of this from anxiety, depression, things like that is really going to affect your gut health as well.
Okay, that's fascinating. So as far as anything you put into your gut, it can instantly impact what's in your head.
Absolutely.
Or your feelings, right?
Absolutely. And especially foods like fiber are very important in terms of feeding that gut bacteria, because that is what is going to set the mood in your head.
I know, as soon as you said serotonin, I'm like, how do we get more of that? I would like that. Are there foods that are really going to impact that and make you just feel better?
Absolutely.
Okay.
So first and foremost, you can have foods such as chia seeds, fiber, because that is what's going to feed that good gut bacteria and help that bacteria make that serotonin. And then also getting exercise and sunshine. Little as 30 minutes of aerobic exercise per day is actually going to make your gut bacteria flourish, so that actually makes those good serotonin and other hormones. Also making sure that you get at least 20 minutes of natural sunshine. Here in California, you can definitely get a lot of that. So
we may have to wait for the marine layer, but yes, we can get it.
Getting that sunshine is what's going to make your brain release that serotonin and making sure that you get that happy hormone and getting those endorphins to be released as well.
And I'm curious too, of course, we want to talk about minority mental health. What do you see in your office and with talking to people, how much mental health has been impacted, especially lately, and why for minorities specifically?
Yeah, so every July, we actually observe Minority Mental Health Awareness Month because racial and ethnic minorities have an increased disparity in minority mental health. And a lot of that is exacerbated, I would say, by poverty and food insecurity. And food insecurity is what's tied to poor gut health and mental health. But if you look at a lot of minorities, such as the Black community, the Hispanic community, almost 20% of them are still living under poverty conditions. And with that leads to food insecurity and not being able to access fresh fruits and vegetables.
Okay, so as far as impacting your mental health, just for our viewers at home, if you think you wake up and you're like, I don't feel so good, this donut might make me feel better. Just to explain how much that could hurt you actually.
Yeah, so it's that sugar content. While you get that rush by eating that donut, that'll release dopamine, that good hormone. You feel good temporarily, but it's later on that you have the crash, because that is actually causing for bad bacteria to overgrow, leading to insulin resistance, diabetes, and also anxiety and depression.
Yeah, that crash, I think people know, it's very familiar. And then you think, oh, well, then ice cream will fix that. But no, that's not the strategy that we're going for.
Exactly.
But I do like the advice about, fruits and vegetables, sunshine, working out.
Yes.
For minority communities especially, why is it so difficult to get access to some of that? I mean, what have you seen?
So in terms of mental health access, I mean, the most important things is talking about getting to a mental health provider, talking about the barriers that exist, whether it's language barriers or mental health stigma, because in our culture, as you know, it's very difficult to even talk about mental health, the existence of mental health, and then getting treatment for it is more than one step. And lack of insurance. Not all insurances are being able to cover mental health services. So if you look at it, not all Medicare and Medicaid populations are getting good coverage. And then if they're not being able to cover for providers in their network, or they're not able to provide for a provider who speaks their language, then it's very difficult for minority communities to have someone that they can even talk to.
Right, right. And we just talked about the doctor shortage, even here in San Diego, where it's hard to get an appointment, finding mental health therapists, things like that. Ooh, there's long waiting lists, but it's worth it, right?
Absolutely.
Yeah.
That's where a lot of things start, because mental health is part of overall health, and making sure that you get help for it is extremely important.
I'm curious, with your field, gastroenterology, do you talk about mental health all the time?
All the time,
Yeah.
you know, because people assume that they're separate, but all health begins in the gut.
Yeah.
And again, like I said, mood is made in the gut. So if you keep your gut healthy, you can keep your mind healthy, because again, the brain is controlling so much of the rest of your body that it's important to keep the two very healthy so they can continually symbiotically work.
Okay, as far as just bits of advice, if there's a few things we can do today, right now, for viewers at home, if you want to let them know, what can we do to improve the bacteria? I know it's hard to think about bacteria in our stomach, but what do you suggest?
So the first thing you can do is make sure you get fiber. For women, it's 25 grams of fiber a day. For men, it's up to 38 grams of fiber a day. And you can eat your fresh fruits and veggies. Make sure you get enough water, and make sure you get 7 to 9 hours of sleep. That's really important, because in as little as 48 hours of poor rest, you can start changing your gut bacteria. So make sure you do that. And then if you're in an acute period of stress where you're about to get on television or you're about to do a big performance, you can make sure you do deep breathing exercises where you can do the 4-7-8 technique. You put your hand on top of your abdomen and you breathe in.
Let's do it. Okay.
You breathe in over 4 and out over 7 in your head.
We only have 10 seconds, so do it during commercial break. Dr. Patel, thank you so much.
Thank you so much for having me.
How can people find you real quick?
They can find me on equityandlevity.com, and as well as kumkumpatelmd.com. And before we leave, I just want to make sure that you know that women are also minorities. I'm having an event this September in Costa Mesa called the Equity and Levity Summit to help encourage the personal and professional advancement for women. And this is going to be an amazing event. Please don't miss it.
We'll put it all on our website, too. Thank you very much for joining us.
Thank you so much for having me.